Good afternoon, friends. Myself, Dr. Amit Gupta. I am the head of pediatrics as well as neonatology in Motherhood Hospital, Noida. Through this small video, I would like to emphasize about the importance of breastfeeds and what are the challenges which a mother with twin pregnancy feels. I know each and every one of us agrees to this fact that breast milk is the liquid gold. There is no comparison. A baby taking breastfeed is more emotionally good. He's having less infections. He's mentally mature. You think of anything, he's much better as compared to what the baby is there when the baby is on top feeds. So a mother who is going to have a twin pregnancy always is going to have a little issues deciding whether to give a top feed or the breastfeed. Remember, breastfeed is the best and there is no option for it. That there is no solution that is the best try for it. So once you know that you are a mother to a twin baby, what you should do at least start talking to your gynae, start reading blogs, start reading different articles that what are the different positions in which you can keep the baby on breast. Make sure you show your breast to your gynecologist so that if your nipples are having any issues, like if your nipples are inverted or the size is small or there is some issues XYZ, whatever is there with the nipples, that can be sorted out before you end up delivering the baby. Once the baby gets delivered, make sure that you have to give that golden touch to the baby. I always say it's a golden touch because that is important. Once the baby get born, make sure the baby get onto the breast for a little bit of the time. This initial suckling of the baby on the breast will give you a little bonding with your baby as well as it will stimulate your breast milk. Remember, this is the moment which every mother relish, and I want you to read what is this golden touch so that at least you end up putting the baby immediately on the breast. Now, after 24 hours, within 24 to 48 hours, your breast is going to pump a little bit of milk that is liquid gold. That yellow colored milk which happens is the liquid gold, I always say. So whatever you have fought throughout your life, it is this liquid milk which initially comes as like a first vaccine to the baby. It consists of a lot of antibodies, lot of nutrients. So in fact, it is good for the baby. You have to make sure that you have to insist, talk to your pediatrician, talk to your gynecologist that you want to give exclusive breastfeed to the baby. Now, since you have two babies, it's always a challenge. So you have to take help from your relatives, maybe from your lactation consultants, because you can do either of the way. First, in the best ways, you put your both babies simultaneously on the breast. There are different positions like a football position or just lying down also you can keep both the baby on breast. Beforehand, read what is latching, what are the different positions in which you can keep the baby. So simultaneously on both your breasts you can keep the baby. Both the babies will take feeds nicely and I'm sure you're going to go through it successfully. If you feel a little exhausted, though the WHO says the breast milk is the best for the baby, but still a little bit of top up can be done. But always remember, breast milk is the best. Try to give lot of breast, but since you get exhausted, a little bit of top up can be done. Make sure, since you have to produce a lot of breast milk for your twin babies, you have to have a good nutritious diet. Have a well balanced, good diet. Eat lot of good food. Drink lot of milk, lot of juices, lot of coconut water, and the most important thing, have a healthy mind. Your stress-free mind is the best thing which will help you to produce a lot of milk. The more positive you are, I'm sure you will end up giving both your twins an exclusive 6 months of breastfeeds. Thank you.
Motherhood Hospitals. We care like no other.